Hi everybody, this is Dr. Ihab Abdurrahman, Ihab Tarawa, consultant of acute care medicine at Soba University Hospital, professor of medicine, University of Khartoum. I would like to welcome all of you to this course about medication safety course. This is an introduction to medication without harm, which try to cover some of the third challenge endorsed by the WHO in 2017 about medication without harm. This is the introductory lecture. The outcome to highlight the third patient safety challenge, discuss the significance of medication errors. The WHO launched the first challenge in 2005. It was about clean care is safe care. That was followed by Safe Surgery, Save Life. And in 2017, they launched the third patient safety challenge, medication without harm. After launching that challenge, their aim was to reduce severe patient harm due to medication error by 50%. Everyone in the world will, at some point in his life, will take medicine to treat or to prevent illness. Although medicine have increased life expectancy, patients live longer with better quality of life despite disease, but medication can cause significant harm. The magnitude of this problem, patient harm due to unsafe care, is the leading cause of death and disability worldwide. Most of such harm is avoidable. Harm due to medicine and therapeutic option account for nearly 50% of overall preventable harm in medical care. The pooled prevalence of preventable medication-related harm was 5%. That is 1 in 20 patients. 1/4 of the harm was severe or potentially life-threatening. The prevalence of preventable medication harm was nearly double in low and middle income country. It is reported that to be 1 in 14, that is 7% in low and middle income country compared to 1 in 25, which is 4% in high income countries. The financial burden is huge. It is significant. Medication error contribute to 9% of world total avoidable cost of health care, which represent 0.7% of total health expenditure worldwide, which amount to 42 billion US dollar estimated to be spent in medication error. The Organization of Economic Cooperation and Development report in 2022 indicates that 1 in 10 hospitalization in Organization of Economic Cooperation and Development occur due to medication-related harm, and 1 in 5 hospitalized patients experience medication-related harm. Here, this figure shows that the significance of the problem. Patient harm due to unsafe medical care is a leading cause of death and disability worldwide, and most patient harm is avoidable. 1 in 20 patients globally experience preventable medication-related harm in medical care. 50% of preventable patient harm is related to medicine and therapeutic intervention. 1/4 of preventable harm is considered severe or life-threatening. Before we dive in, let us explain what is adverse drug event, adverse drug reaction, and medication error. Medicine may result in adverse drug event, which are defined as any injury resulting from medical intervention related to a drug, including both adverse drug reaction in which no error was involved, or as well as complication resulting from medication errors. Some adverse drug events are preventable and predictable, while other reactions are due to medicine itself and are not predictable. Those reactions which are not predictable or avoidable, these are known as adverse drug reaction, defined as a response to drug which is noxious, unintended, and that occur at usual dose to treat or for prophylaxis of illnesses. If you look here in this figure, adverse drug event, it could be adverse drug reaction which are not preventable, not avoidable, unless you know that the patient has allergy, then it could be a preventable reaction. Preventable adverse drug event, and this is count as medication error. Also, in medication error, we have potential adverse drug event, trivial medication error. In this figure, you see medication error and you see adverse event. Adverse event, harm caused by medication, which adverse drug reaction, and preventable adverse drug event, which could be medication error. So medication error could be adverse drug event and it could be others. Preventable adverse drug event are medication error, defined as any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in control of healthcare professional or patient or consumer. Such event may be related to professional practice, healthcare product, procedures, and system. This includes prescribing, order communication, product labeling, packaging, and nomenclature, compounding, dispensing, distribution, administration, education, monitoring, and use. It's a big spectrum. Drug can cause a spectrum of event. The National Coordination Council for Medication Error Reporting and Prevention classifies these reactions from category A, going through B, C, D, E, up to I. I are severe reactions that lead to this. A, category A are an error that lead to potential harm. So it didn't cause a harm, but the presence of the drug or the intervention could have led to a harm. So categories could be low harm, serious, or life-threatening. Type C reaction, error would cause, the error would not cause patient harm. D, error would have required monitoring to preclude harm. Type E, error would cause patient temporary harm. Type F, error would cause patient temporary harm and require initial prolonged hospitalization or any outpatient medical encounter. Type G, the error would have caused permanent patient harm. And type H, the error would have required intervention necessary to sustain life. And type I, error have caused patient death. Error can happen during the medication pathway, prescribing, dispensing, administering, monitoring. Prescribing, this is very prevalent and it accounts for 53% of the errors. Prescribing error defined as mistake made by prescriber when ordering a medication occur during prescription of medicine. It covers when you use the medication for wrong indication, when there is drug-disease interaction or drug-drug interaction, dosing error and formulation error or inappropriate prescribing. It can also include failure to prescribe a drug. For example, someone after hip surgery, if you don't prescribe DVT prophylaxis, or to prevent also when you fail to prevent adverse event of other drug. For example, someone with history of peptic ulcer disease, you are prescribing an steroidal anti-inflammatory drug and you fail to give peptic ulcer prophylaxis. In hospitalized patient, median prescribing error rate of 7% in medication order. In low and middle income countries, this can go up to 78%. It is a huge and significant burden in low and middle income country. Poor legibility seen in about 50% of prescription. Transcribing error occur during order communication due to incorrect data recording by healthcare or care worker. This represents any discrepancies between physician medication order and medication order written into any document related to the patient concern, such as medical record, medication chart, medication request sheet, discharge medication chart, or any other document. The reported transcribing error can range from 15 to 70%, depend on the healthcare setting. Dispensing error are defined as deviation from the prescriber's order made by staff in the pharmacy when distributing medication to nurse unit or to the patient in the outpatient setting. Systemic review reported that dispensing error count for 0.015 to 33%. The most common factor associated with dispensing is related to workload and failure to store in appropriate manner. Administration error, any discrepancy between how medication is given to the patient and the direction of administration from the physician order or hospital guideline. The prevalence of administration error account for 22% of errors. Finally, monitoring, failure to review prescribed regimen for appropriateness and to detect problem or failure to use appropriate clinical or laboratory data necessary to monitor patient response. For example, those in anticoagulant warfarin might need to have INR monitoring. Those in insulin, they need blood glucose monitoring. When we fail to do this monitoring error were the next most common preventable medication error after prescribing error, and it accounts for 36 to 47%. There are areas of high concern. It's about polypharmacy, medication use in transitional use and high-risk situation, and we will have other session discussing these issues in more details. Take home, medication errors are significant cause of harm. Prescribing, administering, and monitoring are area of concern. High-risk situation of medication error require active intervention. Thank you and see you in the next session.